we throw light on lupus, a chronic autoimmune disease which occurs when the body's immune system produces antibodies that attack its own healthy tissues and organs instead of foreign antigens. This systemic inflammation can trigger various symptoms such as swelling, pain, and other debilitating health conditions. Lupus symptoms are particularly severe in people of African descent. It is estimated that 5 million people worldwide have some form of lupus. It primarily affects women of childbearing age between 15 and 44 years old. However, men, children, and adolescents can also develop lupus. Lupus remains largely misunderstood and underdiagnosed in many African countries. Hello everyone and welcome to Our Voices. I am Jeannie Niwa, joined by my co-host Oriane Tangishaka and Simini Shiekoye. In this episode, we will focus on this chronic autoimmune disease, its symptoms, its causes, and its treatments, right?
Right, yeah.
So when you hear lupus, how familiar are you with this disease?
Honestly speaking, I didn't know much about lupus until we started working on this show.
Right.
And I was really shocked to see how it affects mainly people of African descent and women of childbearing age, like as you mentioned, between 15 and 44. And I was trying to read, and it says 9 out of 10 people with the disease are women. It's a very, it's a very big number. So it's about time that we talk about lupus today. And I can't wait for our experts to come and explain to us what causes it, what the symptoms are, and what do we need to understand about this disease.
Yeah, definitely. I am not one to say that I know much about it. I do know one person, one of my friends back in the days, who had told me that they had diagnosed him with lupus, and he also didn't have much information about it. So, I'm really looking forward to hear more about it, especially when they say that it affects mostly people of African descent. I'm always wanting to know, like, how does that work? Why? And what's the cause exactly for people of African descent?
Yeah, and it's it's still called mysterious, and like you said, experts gonna will tell us more. Well, I happen to know 2 women also of African descent, and I think the key word here and the most thing that you hear is pain. It's pain. It's a fluctuating illness where its symptoms wax and wane. So patients have to learn how to manage the pain. From what I understand, the flare-ups, the inflammation, the pain from inflammation that go on for days or weeks. And I've seen their weight also fluctuate significantly. Like you can be from overweight to skinny. That's what I've seen with them. And the condition reminds me of people with sickle cell. Like you can have this social life with this person and then they disappear and tell you that, they were just in pain and they couldn't take it. And, and then they reappear when, everything was managed. So as you can imagine, lupus can cause severe emotional trauma. And it's also from, what I hear, it's also attached to trauma. Well, the expert will tell us more about that.
Yeah, definitely. We'll touch on that in a moment. And like you mentioned earlier, Ginny, despite lupus being a serious and relatively widespread autoimmune disease, it remains largely misunderstood and underdiagnosed in many African countries. Medical experts said patients of African origin and mixed racial ancestry have the most aggressive form of lupus. Vicky Stark reports from Cape Town in South Africa.
57-year-old Mariam Steris was diagnosed with lupus on the brain 18 years ago. The chronic autoimmune disease occurs when instead of protecting the body, the immune system attacks its own healthy tissue. This affects the joints, skin, blood vessels, and organs, and in some cases can be life-threatening.
My symptoms were memory lapses, concentration problems, psychotic behavior, weight loss. And I never showed any usual symptoms that normally comes with lupus, like the butterfly rash in the face or the mouth ulcers.
Sadly, the mother of 2 had to quit her job because of the disease. However, she used her organizing skills to set up a support group for lupus sufferers. Steris says the connection with the group makes a huge difference.
One moment you can feel like you're on top of the world. You feel like you can go climb a mountain. And the next minute you will be so tired or you will have so much pain, then you literally can't even do anything.
Professor Riet de Toy is head of the Division of Rheumatology at Tygerberg Hospital in Cape Town. She says the exact cause of lupus is still unknown.
It's not something that they've been able to identify a single gene and say that is what it is and that's why it's hereditary. There are many other factors that play a role.
Professor de Toy adds that while statistics for Africa are scant, there is medical evidence to show that young, black and mixed-race women are most likely to contract the aggressive form of the disease.
What we do know is that in the African continent, it's probably at least 10-fold as common as we see in Europe. And we're talking about a pooled prevalence, so putting sort of all these different prevalence studies together of about 1.7 to 2% of the population. And while in Europe, it's less than 1%.
Professor de Toy says treatment in other parts of Africa can be challenging because it's not just about access to health care, but also about the availability of expertise in hospitals. Many facilities on the African continent lack the necessary tests required to confirm lupus or to do kidney biopsies to confirm the most frequently seen serious complications from the disease. She says lupus is often misdiagnosed as HIV or malaria.
I mean, if we look at chloroquine, most countries do have access to that. Corticosteroids, yes. It's the more specialized immune-directed therapies that perhaps are not available. But I think the most important thing is if you don't diagnose the disease and recognize the complications, that's where the brunt of the problem is.
Professor de Toy says while there is much to be done to raise awareness, efforts by the African League of Associations for Rheumatology and others to educate healthcare professionals is a step in the right direction. Vicky Stark, VOA News, Cape Town, South Africa.
Thank you, Vicky, for this report. Joining us today is Dr. Ndelela Nadine Mbuyi, a rheumatologist and assistant professor at George Washington University School of Medicine and Health Science here in Washington, D.C. She also serves the program as a program director of rheumatology fellowship at the same hospital. Hello, Dr. Mbuyi, and welcome.
Hello, thank you so much for having me on the show. It's a pleasure to be here.
It's a pleasure to have you.
Absolutely.
So we're calling this disease mysterious,
Correct.
where my colleague here says that 9 out of 10 of these patients are women. So let's clear out and, give us more information.
Absolutely.
People who suffer from lupus are not always aware of having this disorder, because its symptoms are not always visible, right?
Correct.
So can you give us a rundown of the characteristic of this autoimmune chronic disease?
Yes, absolutely. And I want to start by thanking you actually for bringing light to this disease. Like I said earlier, I keep an active practice at George Washington University, and lupus is actually one of my clinical interests. And part of the reason why I chose rheumatology as a career, because there's a pretty big subset of autoimmune diseases, including lupus, that primarily affect young women of African descent. Now, in terms of characteristics of the disease, lupus, as you mentioned earlier, is a chronic autoimmune disease. So essentially, the immune system goes haywire and starts to attack the patient's own cells. And so it causes widespread inflammation in the body, and as a result of that inflammation, different organ systems can become affected. And so the symptoms will largely vary on which organ systems are affected, and which is why the symptoms of lupus are not always the same from one person to the next. So it might be very difficult to identify the symptoms because, again, they can be very, very varied. Some people, for example, will present with rashes. Others will have primarily joint pains and inflammation in their joints, whereas other people will get inflammation of the lining of the heart or the lining of the lungs, which can lead to symptoms of chest pain.
Yeah, that's a good rundown. We'll continue the conversation. With that said, let's hear from viewers in Dar es Salaam, Tanzania, on what they know about the disease. They are Ebenezer Johanna, Faustina Goodluck, Godfrey Jengila, and Johnson Pende in Your Voice segment.
This lupus disease for me, as I understand it, it's based on individual immune system, but it's not easy to say it's infectious. So from my perspective, I have not read it anywhere, but I feel it is a non-communicable disease. The problem comes from human immune systems that have experienced certain mineral or vitamin deficiencies. The treatment is problematic, especially considering when you talk about one's own immune system and cell issues, it is often difficult. I haven't read widely about this disease yet, so I don't know if there's a possibility of going to the hospital and getting treatment quickly. But what I can say is, it takes a long time until someone recovers.
Lupus is a disease that attacks the body's immune system, where it attacks the tissues as well as its organs. Many people may confuse lupus with cancer because its symptoms can be identical. For example, hair shaving is one of the corresponding symptoms. No, lupus is not contagious because the disease attacks a person's immune system. I think proper education is needed to tell the community about how this disease is entering the body and what methods should be used to help somebody who is suffering from this disease.
First, you have to go to the hospital to see a dermatologist so that he can make a diagnosis for you. Because at the level we have reached, only a skin health professional can identify the problem he sees in your skin. That's why it's important to see a doctor for further diagnosis and advice. And if a doctor finds it out of his control, he will direct you to see another health professional.
Lupus, in my view, is an inherited genetic disease that attacks the immune system. But it also occurs in the body with many symptoms, including skin damage in the human body, which is often about genetics.
Wow. Well, thank you for the people of Dar es Salaam for sharing what they think and what they know about lupus. Let me come back to you. Earlier, you told us the symptoms of lupus, right? But what causes it and why is it so high in people of African descent?
Yeah, so that's a great question. So in general, lupus is thought to be really caused by different things, and typically we think about it as a disease that comes about due to an interplay between genetic factors, hormonal factors, but also environmental factors. So at baseline, someone with lupus has the proper genetic background, and at some point in their life, they have a trigger. Whether that trigger is an infection or something in the environment, it turns on their genes, and that leads to a cascade of events that leads to the immune system going haywire, and that's really how.
So it passed down from generation to generation, is that why?
So there is a genetic component to lupus. It's not passed down directly in the sense that, if, your mom or your dad has it, you'll automatically get it, but there is a risk there. And, just like I mentioned, so you need the proper genetic background, which will come from your parents, and then a secondary trigger, which is typically something in the environment or an infection or whatever that second trigger may be.
So that's why if it was in the African American people's descent, and then it kind of stays there because it's sort of like, okay.
Absolutely.
Now, the people who have it, I mean, I'm sure they want to know this very mysterious disease. Do the medical systems put enough resources to try to figure out things about it and really put finances there to make sure that, maybe research is done and things like that?
So, great question, and I can speak to the United States healthcare system, which is where I practice. In the United States, lupus and autoimmune diseases, if you compare them to diseases like hypertension and diabetes that are more widespread, it's still considered to be a rare disease. And as a result, it means that there are some research funds that go towards towards these diseases, but unfortunately, probably not enough at this point. So that's where we are right now, but there's always a push, in the medical community, in the rheumatology community to allocate more funds to lupus research.
And from that point, how is it diagnosed?
So great question as well. So the diagnosis can be quite complex, again, because lupus doesn't look the same in two different people. Now, because it's really the main issue is the immune system going haywire and affecting different organ systems, no two organ systems are affected the same way in two people. So rheumatologists typically use a combination of symptoms, but also physical exam findings, and we use laboratory data and imaging data to support the diagnosis. So it's not really one lab data or one single imaging study that will give us the diagnosis, but we'll talk to the patient, gather a list of what their symptoms are, and do a physical exam, and then if we're suspicious for lupus at that point, we go on to check labs and imaging studies to support our suspicion.
So I think one question people have right now is it treated? Can people get cured?
There are effective treatment for lupus. We unfortunately at this point in time don't have a cure for it. It's a chronic disease, but a lot of people can live with the disease in a healthy way. And that's really the goal of treatment at this point. And the treatment will really depend on what organ systems are affected, but there are effective therapies available.
Without flare-ups, that's how they will live healthy.
So not necessarily, again, because the disease doesn't really affect people the same way.
Right, so many questions.
Absolutely.
But we definitely can continue this conversation. This is time for a short break. Coming up, Josephine Ngui, lupus warrior and CEO of Lupus Foundation of Africa, will join us via Zoom from Nairobi, Kenya. She will share her work and life experience dealing with this disease. We also want to hear from you. Join us on Facebook, Instagram, X, formerly known as Twitter, at VOA Africa using the hashtag VOA Our Voices. We'll be right back. Stay with us.
In times of change, when the world seems uncertain and what we hear doesn't reflect what we see, we seek the truth. When we are told only part of the story, we lose trust. In moments of crisis, our dreams, hopes, and wishes for a better tomorrow depends on a free press. At Voice of America, we bring you the stories that people take risks to see. We connect the world and unite it with truth. At Voice of America, we show you the whole picture.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linor Moudou, in Washington, every week on Healthy Living, right here on VOA.
Welcome back. You're here with us on Our Voices, and today we're learning more about lupus and living with this chronic disease. Here with us is rheumatologist and assistant professor at George Washington University School of Medicine and Health Science is Dr. Ndelela Nadine Mbuyi. Now Josephine Ngui, lupus warrior and CEO of Lupus Foundation of Africa, is also joining us via Zoom from Nairobi, Kenya. Welcome, Josephine. Ms. Josephine, hello.
Thank you, thank you.
It's a pleasure to have you.
Thank you for the invitation.
Absolutely.
Yeah, so when we heard that in Africa, especially, if I can just jump in, is that it's very hard to diagnose this disease. How was your journey into figuring out that's exactly what you had?
Basically, I was born with lupus. And then I used to be sick when I was young, and then my parents never used to understand what it was until the time I was between 7 to 8 years, is when I was taken to a clinic. In fact, it was a Indian doctor. You can hear me?
So,
yeah. So
go ahead.
The doctor, at that time, I had the butterfly rash on my face. And then we did the blood test, and he continued on treating me, giving me medication for application on my face, on the rashes, until one day there was another doctor who came and diagnosed me and said, "This is lupus." And then the first drug I was given, as much as I was young, because I was less than 10 years, I was given prednisone.
Wow.
Prednisone and Imuran for treatment.
Wow.
And a cream to, cream to apply on my face. And then that one, it took for a while. It went on for a while. And then when the symptoms would go down, I'll stop taking the medication. Because normally when you are young, you think when you have taken your medication, you are healed.
Yeah, so did you know anything when you were diagnosed? Did you know anything about that disease?
No. We knew nothing. My parents did not even know, because no one knew about it. But the doctor gave my dad some booklets to go and read. But my dad could not understand it. That journey went on for a while until when I was between 20 and 21 years. That time I was in college, and I got the worst flares on the face. The rash now developed to bleeding. They were bleeding on both cheeks. On the bridge of the nose, there was a big wound. It was a wound, was a rash.
Yes, so once you found out, tell us how have you been treating yourself? What kind of treatment have you been receiving? Maybe doctor, you can also tell us how should people treat themselves when they found out?
Absolutely. Go ahead, Ms.
Josephine, go ahead.
Yes, the first medication I was given, as I've told you there, it was prednisone. But first, when I was diagnosed with lupus, as I was growing up, I accepted the disease. The most important part of it was the diagnosis of the disease. And then the second part of it was acceptance. I accepted the disease myself. That I have a condition, I don't know the cause, I don't know where it came from, because from my lineage, we don't have anyone else who has the disease. So I accepted the disease, and that is where I think my healing started from. As much as I used to have flares, I still have flares to date. Right now, I'm 46 years. And it is a tough journey, because you have to take the medication, and then the medication increase with time. Because initially I used to be on prednisone and Imuran and the cream to apply on my face. But as time went by, and now I managed to get a doctor who is a rheumatologist here in Nairobi, and I was given more drugs. That is the time I was put on SCQS, osteocare, because of the calcium. Also, there's another drug.
Josephine, maybe in addition to the medical treatments and the drugs prescribed, maybe if there are any lifestyle changes people with lupus need to do, how should people treat themselves?
Yeah, absolutely. So as you can imagine, getting a diagnosis of lupus can be, life-altering. So the first thing we typically recommend, for patients is to have a good core group of family and friends that they can rely on to cope with the disease. It is a journey because this is a chronic disease. The second thing we recommend, because oftentimes patients develop rashes after sun exposure, so avoidance of sun exposure. And if, someone has to be in the sun, we typically recommend that they apply sunscreen regularly throughout the day, and that they repeat, they keep reapplying it throughout the day to avoid the rashes from reoccurring. In terms of dietary changes, for example, it is very, very difficult to advise, people on that because to my knowledge, we don't have any large-scale clinical studies to validate one particular type of diet.
Right. And it's really good also to see that she went from 10 years old to 47, and
Absolutely.
It's a long, you
can
live with it. And
so Josephine has a foundation to help other people also understand. So tell us briefly, Josephine, how does your foundation help others?
There is a lot of creation of awareness. When people meet, we also invite we invite other people. We put it in the public, like on TV, that there's a meeting on this particular day about lupus, and many people turn up, and then there is that creation of awareness. Also, the support group, when they come in, is like people also share their stories, their experiences, on what they do about their lifestyles, what they eat, what is good for their health.
Good.
We also discuss more on our development, what someone can do to improve themselves. There are those people who cannot manage to go to work because the lupus is too much.
Thank you, Ms. Josephine. This is where we conclude today's show. A big thank you to our guest, rheumatologist Dr. Ndelela Nadine Mbuyi, assistant professor at George Washington University School of Medicine and Health Sciences, as well as lupus warrior Josephine Ngui of the Lupus Foundation of Africa, for sharing their insight and expertise. We'll see you next week with another exciting program. Until then, keep living your best life with hope and resilience.